I'm Mary Stagg, infection preventionist for Chase Brexton.
And I'm Dr. Sebastian Ruhs, the Interim Chief Medical Officer and Director of Infectious Diseases at Chase Brexton.
Dr. Ruhs, who is most at risk for getting coronavirus?
So that's a very good question. And I think there are two components to this answer. First is who's at risk of getting corona, and then who is at risk of becoming symptomatic or getting sick from coronavirus. And so there's very little data available and a lot of data collecting going on currently. So what we know is it seems like that everyone is at the same risk of getting corona. So what increases the risk is obviously having a lot of contact with people in the community, traveling and going into crowded areas. But the more important question, I think, is who is at risk of becoming symptomatic. And so what we know is it looks that 80% of people who get infected with corona have very little to no symptoms. It's only 20% of people that are expected to show more severe kind of symptoms. And at highest risk of becoming severely symptomatic are people who have some pre-existing conditions, especially pre-existing heart conditions, poorly controlled diabetes, or pulmonary conditions. And then there's also an age component to that. People at younger age are less likely to get severe disease, and the older someone gets, the higher the risk is of getting a severe case of infection.
I see. And isn't this just a bad cold, though?
Well, yes and no. Coronaviruses, there are multiple coronaviruses that have been known for a long period of time, and some of those cause things like just common cold or a bad kind of cold. So this particular coronavirus is a little bit more aggressive, and this is why most countries are taking precautionary measurements at this point, because there is this 15 to 20% of people who might have or might develop more severe kind of disease pictures.
So if I do get sick, when should I call my provider, or should I go to the ED?
Yeah, so that's a very good question. People who show signs of severe disease, high fever, and especially respiratory signs and symptoms, difficulty breathing, and especially in people who have underlying heart conditions or pulmonary conditions or poorly controlled diabetes. So those are probably better served in the emergency room. Make sure that those people don't require a hospital admission. If someone is mid-aged, a healthy person, has some mild fever and some mild respiratory symptoms, so those are probably better served coming to their primary care physician. What we recommend for everyone who shows any kind of symptoms of viral illness to call, no matter where they go, first. Doesn't matter if it's the emergency room or the primary care office, but everyone should call first and get triaged over the phone and get some initial advice.
Okay, and why is everyone saying that washing your hands is such a big deal?
Yeah. So let's talk about how corona is spread. And so mostly it's from respiratory secretions. So it's from someone coughing or sneezing into the air and someone else inhaling it, inhaling those droplets. So there's besides social distancing, there isn't too much that we otherwise can do about it in the social context in the community. However, someone who is symptomatic and spreading the virus, if they cough into the hand, if they sneeze into the hand, and they shake someone else's hand, or they open a door, or they go into the grocery store and pushing the shopping cart, the next person who comes there and touches these items then is at risk of carrying the virus on their hands. So with frequent hand washing, that's the best protection. That's the best protection by washing the virus literally off the hand. This, when that person then touches food, eats, or rubs their eyes, then they're at risk of getting in contact with the virus and getting infected.
Mm-hmm. So why shouldn't I wear a face mask all over the place?
Well, So there are different kinds of face masks. The one that you're probably referring to are the ones that we start seeing out in the community a little bit more. Those are called surgical face masks. Surgical face masks are open on the sides, and so they are letting air in and out through the sides and from below and above, and a little bit of breathing occurs in front. Those masks are actually not designed to protect me from germs from anybody else. Those masks are designed to be worn by a sick person to prevent spreading anything into the community. Because of the way how these masks are designed, they also don't last and protect for very long. Once they start getting wet or moist, kind of their time of the protection time is kind of expired at that point. So they need to be changed frequently. So those masks are really important to be worn if a patient comes into a doctor's office, for example, and that patient has a cough and a fever, for that patient to put on the mask to prevent when coughing and sneezing to spread aerosolized respiratory secretions into the air.
Thank you, Dr. Ruhs.
Welcome.